Cancer Care Ontario is to think about how we engage people. And in the past, what we've done is we've gone out and sought consultation. We've asked stakeholders to tell us what they think. But that's a lot of going out and asking for advice. And we really felt that it was important for us to have, if you will, an internal expert advisory group. And the best people who have the most expertise to really advise in terms of the patient experience are patients and family members.
Maybe one of the things they could do is educate your primary nurses, because I know when I started the whole process,
you don't know what it's like to have cancer until you have cancer.
You actually speak to is your
people, like a lot of people
nurse.
say, oh, I know how you feel, or I can only imagine, or whatever, but you don't get it till you get it.
If you had to talk to me at the beginning about, quality of life rather than end of life, I might be more open to the concept.
Patient engagement is very important to Cancer Care Ontario because we're a provincial agency that looks at the performance of the cancer system.
So we've invited
we have often looked through the lens of how clinicians work in the system.
And really the idea today is get your feedback.
And now we're seeing that really if we want to improve the patient experience, we need to look through a lens of patients and really understand what the experience means to them.
My question is, I think that the thing about palliative care is I think you need to change the culture's way of thinking about what actually palliative care is.
To ensure that members of the Patient and Family Advisory Council were going to be successful, we thought it was very important that we help develop skills in how to be an effective member of a council.
It needs to be brought up early enough and explained in a friendly manner so that people actually understand the process of palliative care.
We're bringing, in most cases, lay people who may have not had much experience in working with high-level decision makers into boardroom settings.
To remove that stigma.
We're saying, hey, you're important, we want your voice, we want you to make decisions.
Because your concern right now is there's a bit of a negative attitude about what palliative care is.
And we wanted these individuals to be empowered to share those thoughts and voices with decision makers.
I think it would be best if there were a person that each patient had access to, perhaps not every appointment, but somebody that you knew you could turn to for these issues, because certainly 4 years ago there was no palliative care at the cancer center. There was never one word about it. There was never a person or a department or any information at all for my husband, even though they knew he was dying before he started treatment.
I think that that's the most important element, understanding the patient's experience. Because if you don't listen to those stories, you won't understand what they've gone through.
And sometimes when people go to appointments, they're really anxious, and when people are talking to them, they may not even comprehend what's being said to them.
Given that we have a very large province, not everybody is able to travel. So what we've done, we schedule the video conference calls, so we're using the Ontario Telemedicine Network to facilitate some of that.
No, you're still on mute. There you go. Yes, you're good.
At the beginning it was very hard. We actually, it was a new technology for us here.
There, I got the button on.
It does diminish some of that personal contact. However, when we think about the sustainability of a council like this one and ensuring that we truly have diverse provincial representation, we really have no choice but to use and support a virtual mode of communication.
So I'm just going to close and ask that summary question. What items would you like to see on the agenda in June?
I think the willingness of members of the Patient Family Advisory Council to talk and voice their opinion is really a measure of our success.
I think that I would like to continue to see updates.
Well, I think it's really nice to hear somebody wanting your opinion.
Of the activities that we have had input on.
I think there's lots of times where somebody will say something at the table or via teleconference, and the people around the table will say, that's a really good point. And I think it's really hard to see something from somebody else's side. And I think that they've taken a lot of time and put a lot of effort into hearing what is being said.
I was really excited to see everyone again. I look forward to our meetings.
I think that the piece I would really stress to organizations that are considering this is those first meetings are extremely important.
I feel very comfortable now that we've gotten to know each other.
You're either going to find that people are going to be engaged with you.
Yeah,
Anya?
I'm thrilled and excited to move forward.
Or they're going to turn off because maybe your messages are not very clear. Or maybe, worst case scenario, you're using that as a token. Oh yes, check that box, we have patient and families engaged. Well, do you really? As in true engagement, true partnership, do you really want to make some system change? Those are the most important elements around patient-family advisory councils.
So no matter what hospital they go to or wherever they're transferred to, it's the same continuity of patient-family centered care.
So I think that the engagement, the dialogue, the listening, the feeding back, the understanding, the evolution, what we did at our first meeting is different from what we're doing today, and that's a good thing. And we probably at our next meeting will take a slightly different stance because we're learning how to work with one another, and that takes time, right? And it takes a commitment.